If you don't work in the mental health field, there are so many aspects of this that can be completely confusing to you, and you really do need someone to guide you. One of the things I do for clients who call me before they even sign up for counseling is try and get a little bit of information about the case so together we can decide what level of care does your child need, or what level of care do you need. So let's just talk about some of the basic levels of care there are. At the bottom, we would say there's support groups. This is where you go when you're not particularly in extreme mental distress, but you have a situation that's really painful for you, such as losing a parent. That's the kind of thing that can make you extremely sad, but you don't necessarily need therapy for. You may be able to go to a support group and process that through with other people who have also lost a parent, and you may come out of that feeling stronger and ready. Next after that would be weekly counseling sessions. And that's when you come in to address maybe a mental health issue, maybe a specific problem, and you learn different tools, you use methods a counselor has, and you let the counselor kind of dig in to get underneath whatever's causing you a lot of pain. And then you try and work through it and come out the other side. After that, we start looking at something called intensive outpatient treatment. This tends to be more for people recovering from an addiction or people with a true difficult mental health diagnosis, such as bipolar disorder, schizophrenia, major depressive disorder, something that's kind of chronic, long-lasting, and really hard to contain because it affects so many aspects of daily life. And that's when you go to a facility during the day, maybe anywhere from 3 to 8 hours, depending on the intensity of the intensive outpatient treatment. And you'll have group processing, individual session time. You might meet with a psychiatrist. You might even see a nurse or a regular doctor to assess your overall physical health. You're working on all the aspects of your life, and your life is so disrupted by what's happening that you're not functioning very well in school or at work, so you need to be in a day hospitalization type program. And then after that, the highest level of care is inpatient treatment, and that's where you stay 24/7 for some limited amount of time. If you're in an acute psychiatric hospital, you'll stay there anywhere from 3 days to even up to 2 or 3 weeks, usually on the shorter end. And then you may be discharged into another residential treatment program where you may be staying for a month or more, trying to really work through everything. Getting back to sleep properly, eating properly, working on your mental health, working on medication, on your physical health, trying to address the whole entire person from start to finish. And then from there you may discharge out of that program down to an intensive outpatient, or sometimes you'll discharge out of that straight into therapy. So I hope that helps you understand when you call in and I'm asking you a lot of questions about your kid or what's going on with you. I'm trying to figure out from the phone call, where do I think you need to be? Because the last thing I want to do is have you come into therapy and spend some good amount of money on it when all you needed was a support group, or come into therapy and really you needed a higher level of care and we can't provide that on a 1 hour per week basis. So I hope that helps you understand some of the different levels of facilities that exist. And feel free to call if you need help figuring out which one's right for you.